People don't also understand the science behind depression and why medication plays a role, a positive role in terms of being one
Yes.
of the tools in that toolkit to
Yes.
actually on the road to wellness.
Yes.
Can you talk to us a little bit about the role of medication?
Yes. So before I talk about medication, I just want to just tell our folks a little bit of background, and then they'll understand why medication works. Okay. So what's gone wrong with depression, as I said earlier, is the brain structure has changed. Now, the thing is, our brains have got amazing chemicals called neurotransmitters, which are released day in, day out, every day, under right conditions, that help us to feel good about life, help us to have the feelings of enjoyment. So what science discovered maybe 10 or 15 years ago is there's a thing called the mind-body connection. So whatever's going on in our minds, our brains, releases chemicals that we feel good. So, for example, Naomi, if I said to you, I love the blouse you're wearing, I love your hairdo, or I said, Naomi, you're an amazing woman. The things that you do for the community. Now, just tell me, even in this few seconds, how do you feel? Like you're already smiling more.
Yeah.
But it releases a good feeling in your body.
Yes.
That feeling has been, you feel that feeling because my words, which you heard, have just released serotonin, dopamine, oxytocin in a big peak. It's just been released in your brain. And so that release in your brain of those neurotransmitters has caused a feeling to come up in your body. Okay. So, and there are lots of things that make those chemicals be released. Just being in a close family, being amongst people where you feel safe, where you feel loved, having good sleep, getting exercise, many, many things, and people should study this because you need to understand how the brain works. But what scientists noticed, has realized, is that when people have depression, a whole lot of those neurochemicals are released in reduced amounts, especially serotonin. Okay, so that's why they feel symptoms in their body like low energy, can't be bothered, tired, guilt, even hating themselves. That's a lot of it is to do with our neurotransmitters. So what medication does is, so medication has been developed that works on the chemicals in our brain. So there are reasons to it. There's a scientific way in which they work, which I don't need to go into now. All you need to understand is that the medication allows serotonin and other chemicals to be around longer in our brains. So we start to feel a boost. We start to feel a little bit more positive. Now, medication isn't the cure-all, okay? So medication won't cure depression, but it helps you to have motivation to get up in the morning, to do certain things that you need to do to live life until you find the root cause of your depression, okay? So the analogy I like is this. Suppose someone breaks a leg. They've broken their leg. Now, you would see a doctor, wouldn't you? You'd get professional help. But what the doctor would do, yes. But what the doctor would do is they put a plaster cast to hold that leg in place until the leg gets healed from the inside. Okay? So antidepressant medication is like the plaster cast. You need it. Yeah, you need it in order to get on with functioning with your life in to some degree, but until the real healing comes on the inside. And the real healing comes really with the therapist, the counselor, with learning new habits of how to deal with situations, within even learning new habits of life, like eating regularly, looking after your sleep, getting proper exercise. So, you know, there are changes that one could do in life that actually help us to become resilient to depression.
Yes. Actually,
But, you know, that,
isn't it? To
so
be
yeah,
ourselves become resilient to depression. If we can
yes,
have
and it's
good
fully
practice.
possible. But you've got to study the condition. You've got to learn the things that strengthen your brain, and then you've got to put them into practice.
Yes, that's incredible. If we sleep well, if our diet is good, we eat well, we exercise. Sleep is quite a huge pillar as well, isn't it? In terms of your mental health in general. Someone asked